A local group wants more women to be educated on how to fight cancer, especially those in the Black community. They say there's a good reason why some might be hesitant in taking necessary steps, but they're looking to change that. 6 News' Joe Harris tells us more about their message and what they're up against.
Saturday was the 3rd annual Strut for the Cure fashion show. Those walking the runway were all cancer survivors, and the event was a celebration of those who beat the disease. Proceeds go toward local breast cancer support group Pink Lotus Project Nebraska, which founder and CEO Tisa Hardin-Partridge says works to teach holistic living to cancer patients.
Without encouragement and hope, we don't have anything else. There's no cure for cancer, and so we are just trying to let people know that you don't have to die from cancer and that there's life after treatment and surgeries and chemo and radiation.
Hardin-Partridge is a breast cancer survivor herself, and she says their work also includes a more specific message on attitudes toward the medical profession. According to the American Cancer Society, Black women are 41% more likely to die of breast cancer than white women, despite being less likely to be diagnosed with it. Hardin-Partridge thinks that's not only because of the care they get from the medical profession, but also because history has led to mistrust of the medical field in the Black community. Case in point, the Tuskegee syphilis study, in which dozens of Black men died and many more experienced severe health problems due to their untreated disease.
That is the main thing that keeps most African Americans from going to the doctor. We've known about those experiments that have happened, and they didn't come out till years later. It just has people just very distrustful of the medical profession.
So she's working to break that reluctance to see doctors about breast cancer or taking part in trials or surveys. She says the key is education. UNMC College of Nursing clinical assistant Professor Dr. Linda Smith echoes that. She says times have changed since the Tuskegee experiment, and there are now internal review boards making sure all research is ethical and people are given full disclosure of the research.
It's important to make sure that you have all of the information in writing that relates to the research, and make sure that your questions are answered and that you understand fully what's involved.
Hardin-Partridge says it's a slow process, but the goal is to get people to be the biggest advocates to their own health. On your side, Joe Harris, 6 News.
Dr. Smith is also the director of the NOAA Clinic, which provides free testing and screening for various health issues. We have that information linked on WOWT.com.